Welcome back to another video on community and public health. Today we are talking about public health disasters, disaster management and preparedness, and the nursing role in that. Now we have 5 different learning goals for today's video. And keep in mind that these learning goals should help guide your study time and be a checklist to make sure that you got everything you needed out of this video. So take a snapshot of this or write them down and come back to them after the video to make sure that you got all the things out of this video that you needed for your studying. Let's go ahead and get into it. So our learning goals today are explain the different types of disaster, discuss the phases of disaster preparedness, describe our role as nurses in disaster management, describe the various agencies that are also involved in disaster management, and then finally, identify some screening tools that are used by nurses in treating patients during a disaster. Okay, so what is a disaster? Well, the International Red Cross and Red Crescent movement has defined it as disasters are serious disruptions to the function of a community that exceed its capacity to cope with its own resources. And so disasters happen when the community can't keep up. They're overwhelmed with the amount of devastation or disaster that's happened, and they need additional resources to help get through that. And so there are different kinds of disasters. There's human-made disasters, there's natural disasters, and then there's a mix of these two, which we call hybrid disasters. So let's take a look at each of these types on their own. So human-made disasters are what they sound like. They're things that people had caused, and it can be intentionally caused or unintentionally caused. So human-made intentional disasters can be things like terrorist attacks, bioterrorism, meaning using biologic organisms like bacteria to cause havoc and disaster in a community, and also mass casualty events and things like gun violence that we're seeing more and more of. Now, human-made disasters can also be unintentional. So things like multi-vehicle collisions, where there are so many victims that the local resources can't keep up with caring for them the way they normally would. Structural collapse, we've heard of bridges collapsing and roadways collapsing or buildings collapsing, or even things like chemical spills. All of these things overwhelm the local community's fire department, police department, and health department and hospitals and require additional resources and strategies to get through these events. Now, the next type of disaster is natural disasters, things that are outside of our control and affect us often with weather. So things like tornadoes, flooding, fires, hurricanes, landslides. These are all natural disasters that affect our communities. And with global warming, we're seeing more and more of these natural disasters each year. Now, a hybrid disaster often starts as a natural disaster, and then human-made elements are also affected. So, for example, a dam break after flooding in an area that damages the dam, or a building collapse after a hurricane because the hurricane caused damage to the building. These are hybrid disasters. So regardless of what kind of disaster you're dealing with, there are phases of disaster management. And these 5 phases can be categorized as disaster prevention, disaster preparedness, disaster response, disaster recovery, and then finally disaster evaluation. And as soon as they make that full cycle on a disaster, we're right back to the prevention step and planning for the next disaster. So it really is a cycle that continues. So what we're going to do is talk through each phase of disaster management, and we're going to talk about the focus of that phase. We're going to talk about different activities that you would see during that phase, and then finally the nursing role for each of these phases. We're going to start, of course, with prevention. So the focus of prevention is to identify risks that could happen to prevent a disaster from happening in the first place. So this is things like assessing structural conditions, bridges and buildings, roadways, contaminated chemicals. And of course, we're not going to be the ones assessing structural damage, but that's what engineers do, is to help prevent disasters from happening. We are going to help identify risks and vulnerable populations. Part of prevention is repairing and removing threats. So by removing threats, we call that mitigating the threat. And then lessening the impact for when disasters do occur. For example, a community may do tree trimming around power lines so that if a tree falls down during a tornado or a severe storm, it's less likely to take power lines down with it. And you can see just from the activities that we're talking about that there are a lot of different agencies and people that are going to be involved in the prevention strategy for disaster management. So what is our role as nurses in prevention? Well, it really depends on where you're working. If you're working as a public health nurse at a health department, your role is going to look different than if you're working as a nurse in an ER or at a health clinic or at a school. But prevention strategies for nurses include things like maintaining our own personal and family disaster plans so that we're really leading by example, encouraging our patients and workplace to have disaster plans available, consider the vulnerable populations in our areas and how we might have an impact at reducing their risks during a disaster, report potential safety and security risks. If you see something, say something so that things get mitigated before they become a problem. And then finally, use infectious control practices. Sometimes disasters happen due to an outbreak of an infection, whether intentional from things like bioterrorism or from a pandemic like we've experienced with COVID-19. And so using good infectious control practices will help prevent the spread of disease. All right, so step 2 of this disaster management phase is preparedness. And the focus here is planning, coordinating, training, and stockpiling. And so activities you're going to see during the preparedness step include things like developing disaster plans for individuals and families, workplaces, and communities, considering vulnerable populations, running drills and trainings, ensuring a chain of command and communication, coordinating efforts. In other words, what are all of the different agencies' roles and responsibilities for when a disaster does happen, and how do those get coordinated and communicated? And then stockpiling supplies so that when we all of a sudden need all of this supplies, masks, IVs, oxygen tanks, that we have a stockpile somewhere to pull from. Now, nursing roles in preparedness and preparing for disasters include things like running or participating in disaster drills so that we have practice so that when real disasters happen, we're ready. Knowing your policies and resources where you work and what is your incident command system, who would run incident command at your workplace. And so how do you know the chain of command and who's going to be in charge and who to communicate to and how to communicate? Understand the local resources and communication. What is the coordination between the local health department, police department, fire department, your hospital, and how does that all work? What is your job in that? Complete disaster trainings. You can complete online trainings through FEMA that can help just prepare you and give you the knowledge of how disaster coordination works. And then understand the ethical goals of mass casualty incidents, or MCIs. So when there are numerous victims that overwhelm a local healthcare system's resources, we shift from giving every single resource to one patient to making sure that the resources are best allocated among those who are most likely to survive. Now, if your coworker or loved one had a heart attack today and went into the hospital and they were not a DNR, they would get every resource available to them. We would have 3 doctors in their room, and we could call cardiology down if it was really needed. We could have as many nurses and help, all for that one patient, to give that patient the slimmest chance of survival after that cardiac arrest. But when we talk about mass casualty incidences, we can't take 3 doctors, 3 nurses, a respiratory therapist, the CT lab, and throw all of these resources into one patient who's has a low likelihood of survivability. We can't do that when we've got 100 other people who actually might survive if we intervened. And so it is this utilitarian, like dystopian kind of feel, really talking about the preservation of the most life possible, not all life. And so we have to channel our resources to those who are most likely to survive in those situations. And that is a really big ethical dilemma, switching our whole philosophy of practice in those times. And so wrestling with that is part of what we do as nurses to prepare for disasters. Okay, the response is the phase when a disaster happens and we need to do something. So the focus of response phase is to act during a disaster, to assess the sufficiency of local resources and attain additional resources as needed, to manage and care for victims, and if a communicable disease is present, to prevent the spread of that communicable disease. So activities in the response include things like establishing incident command. Now, incident command is going to be something that your local hospital will have, your health department will have. There's various levels of incident command to manage and coordinate activities within that organization and between organizations. And hospitals and fire departments go through incident command trainings and drills to make sure that those incident command chains are set up so that there's communication all the way up and through and around these different organizations in a community. So during a response, incident command would be set up. FEMA might be activated. FEMA stands for the Federal Emergency Management Administration. It's a federal level of support for disaster management. And so if the local and state resources to manage an event are overwhelmed, then FEMA will be activated for additional supplies, personnel, first responders, and funding. Other activities during this step include triage and care for victims, and then providing disease surveillance, isolation, and quarantine if bioterrorism or a communicable disease is expected to minimize the impact to the community and prevent the spread. So in a disaster, nurses have many roles. The primary role of most nurses during a disaster is to triage victims and provide first aid based on their triage coding. And we're going to get into how do you code triage patients in a minute in a disaster. We want to make sure we're isolating contagious individuals to prevent the spread of communicable diseases. We're going to document care to make sure that whatever care we're doing is being recorded for these patients. We're going to conduct surveillance of disease. Now, this would be done like on the public health nurse level, but if there is a communicable disease outbreak, that needs to be tracked during this time to prevent its spread and to study its effects. We're going to organize distribution centers, distribution for medical supplies and food and shelter. People are going to be managing behavioral response to stress. We have to take care of ourselves and our colleagues during these stressful disasters. It can be easy to feel overwhelmed and insufficient. And so managing those stressors is an important step of the response, and ensuring the health of healthcare workers. So we have to take care of the people who are taking care of the people to make sure that we have first responders who are able to continue to show up for a natural disaster or for any kind of disaster. Now, in a response, we shift from pouring all of our resources possible into every single patient. We shift that into the greatest good for the greatest number. And so the way we determine that is through triage tools that are only used during a disaster. And there are these different algorithms that are either START and JumpStart, or the SALT mass casualty algorithm. Now, START and JumpStart is the pediatric version of START, and SALT is completely separate. So you're going to, depending on the hospital you work in, you'll see some of these tools. And I put a link in the description box below where that you can go to these tools directly. But these are simple triage. START stands for Simple Triage and Rapid Treatment. And it's an adult triage algorithm that helps determine the patient's likelihood of survival and the amount of resources needed for that survival. So let's take a look at this together. So the patient in an adult patient who's being triaged during a disaster, we need to decide, are they a red, green, black, or yellow tag? A black tag means expectant. Expectant means they are not expected to live. They are expectant to die. And so we are not going to be doing very much care for them. It's just like pain relief and move on to the next patient because they don't have much of a chance. An immediate tag means with immediate intervention and quick medical treatment, this patient could survive. And they are going to be the ones who require the most of our attention during an active disaster. A delayed is a yellow tag, and this means that the victim's transport to the hospital can be delayed, and they may have a serious or potentially life-threatening illnesses, but they can make it a few hours. They don't need immediate care. They could hold on for a few hours. They would be a yellow tag. And then finally, green is your walking, talking, walking wounded. So they are victims with relatively minor injuries. Their status is unlikely to deteriorate over the next few days. And so they can probably assist with their own care, help each other, wrap each other's wounds. We are not going to be giving them much attention right now. And so you're going to use this algorithm to quickly triage them. So are they able to walk? If yes, they are automatically given a green tag. That you're able to walk, that's good enough for me. You're going to wait. If they're not able to walk, we're going to ask if they're spontaneously breathing. If no, we're going to position their airway and open their airway, because sometimes if they just have their airway opened, then they start breathing. And if they start breathing with your open airway, then they are given a red tag where they need immediate care. If you position their airway and they're not breathing and they still don't breathe, we give them a black tag. They are expected to die if they're not already dead, and we move on to the next person who we could help. So if they are spontaneously breathing and their respiratory rate is greater than 30, they get a red tag. They need immediate intervention. But if their respiratory rate is less than 30, we're going to go on and look at their perfusion. Do they have a radial pulse present, or do they have a cap refill less than 2? Great, keep moving on. If they do not have a radial pulse present or cap refill is greater than 2 seconds, they would become a red tag. Now, if their pulse was present or they've got good cap refill and they have good mental status, then they would be a yellow tag. If they have poor mental status, then they would be a red tag. So you can see how you quickly walk through this algorithm for the adult start triage algorithm to tag people into these 4 categories. Now, the jumpstart algorithm is very similar. It's just that kids can respond so easily to just a little bit of breathing. And so we actually do some rescue breaths before we determine that they are a black tag. So other than just opening the airway, we also make sure that we give 5 rescue breaths before determining if they would be black or red. That's the biggest difference here with the kiddos. Now, organizations either use START and Jumpstart, or they use this one called the SALT method, which stands for sort, assess, life-saving interventions, and treatment or transport. And it's very similar. The first step is to sorting. So are they able to walk? Then those are the third ones we're going to assess. Are they able to wave or give purposeful movement? Those are the second group we're going to assess. And are they still, or are they having an obvious life threat? Those are the first group we're going to assess. So who are we going to look at first? That's the first question. The second question here is the individual assessment. So then once we've decided which ones we're going to look at first, we're going to ask them. We're going to do a couple things as life-saving interventions. We're going to control any major bleeding. We're going to open the airway. And if it's a kid, we're going to consider giving some rescue breaths. We might need to do a chest decompression, a needle decompression if they have a pneumo. And if we have auto-injector antidotes available, we may give those. After giving whatever life-saving intervention is needed, are they breathing? If no, move on because they're dead. And if yes, do they obey commands? Do they have a peripheral pulse? Are they in respiratory distress? If any of these things are happening, we would move on to and then consider whether or not they were likely to survive with current resources and either label them as black or red. If they're minor injuries, it would be either green or yellow. So you can see it's a really similar tool. It's not quite as specified as the START or Jump Start, but you may see this when you are working in disaster preparedness. So once we've gotten through the disaster and we move into recovery mode, and the focus of recovery mode is to stabilize the community and return to normal or new normal. Activities look like reunification of families or reunification of pets, financial support for the community, rebuilding, repairing, and resuming activities. Nursing role in this often has to do with family reunification, referrals for ongoing support, especially mental health support, debriefing our teams to making sure everyone who went through the disaster, including healthcare workers, have the time to decompress and debrief, and then assisting the community with rebuilding and returning to normal. And finally, just like the last step of the nursing process is evaluation, the last step of disaster management is to evaluate. The focus is to learn from the past and prepare for the future. So activities look at evaluating the effectiveness of the response and evaluating if there's a need for change to respond to future events. In other words, what went well, what didn't, how can we change this going forward? So nursing roles is going to be participating on a team to evaluate outcomes, writing policies to address any issues that arose during the response. And then public health nurses may be involved in writing an after action report, which is a formal report of the events that happened, things that went well, and things to change. Now, when we're talking about disaster management, there are so many different agencies involved, both governmental and non-governmental. So governmental agencies involved in disaster management include NIMS, which is the National Incident Management System. The Army National Guard can be provided to provide resources and personnel and even help with healthcare. FEMA is that Federal Emergency Management Association from the government to help coordinate federal level government assistance during a disaster. The local and state health departments are going to be involved, as will the local fire and police and paramedic departments. And of course, keep in mind that hospitals, both governmental and private, will be involved as well. So the roles of the governmental agencies in a disaster include coordinating services, providing funding, providing resources and personnel, maintaining law and order, and treating victims. And then there'll be many non-governmental agencies involved, like the American Red Cross, the Medical Reserve Corps, or MRC, and the Community Emergency Response Team, or CERTs. Those are both volunteer organizations for medical personnel to volunteer to respond to emergencies and disasters. You can see local not-for-profits and for-profit businesses being involved in providing resources, shelter, and other needs during a disaster. And of course, the local religious organizations are often used as public shelters and places for distribution centers. Now, the roles of non-governmental agencies are things like food, shelter, housing, and for the MRCs and CERTs, certainly healthcare would be a part of that as well. So if you're wondering how you can help and be prepared for disaster management as a nursing student and novice nurse, you can join a local MRC or CERT that can be sent out to different disasters to help care for people in their community. You can take the ICS training online. ICS 100 through FEMA will really help you have a broader understanding of disaster preparedness and coordination of different agencies. You can prepare your own emergency supply kit and family plan for disasters. And there's tons of resources online. A quick Google search will help you with that. And then finally, familiarize yourself with the disaster preparedness policy and procedures at your place of work. It really is about preventing and mitigating these disasters and being prepared as individuals and as the community. And as nurses, we play a part in that. All right, that's going to wrap it up for our chat on disaster and public health disasters. Thanks so much for studying with me today. Remember, you are smart, you are capable, you are loved, and you got this. I'll see you next time.